Hey guys, it's me, the TravelER here. Today we're going to go over 10 characteristics that I believe make for a very successful travel nurse. Although many people can be a travel nurse, I believe that if you have these 10 characteristics, it'll be a lot easier for you and a lot more pleasant for those around you. Let's get into it. So I will start by saying that when I talk to a lot of nurses, they feel like their skills are not good enough yet to be a travel nurse. And I'll tell you that it is not all about being the smartest nurse in the world to be a travel nurse. You don't have to be 100% in your skills. And that's also why before you start an assignment, they make you take a skills test, your agency does. And depending on how you score in your skills test and what skills you're comfortable in, they will match you with the facility that needs that similar type of skill set that you have. The first characteristic we'll say is you have to be teachable. So you don't have to be the smartest nurse, but you do have to be a nurse that is going to be able to be taught. So when you go to these different facilities, they're all different. They're going to teach you their ways. They're going to do things. You want to be very open into receiving what people are teaching you. The second characteristic will be to be a fast learner. It should be very important that you would have the ability to just dive in because, like I said, you're not a new nurse. This is you going in to help them. They need the help right away. They don't want to be having to teach you something over and over several times. You know, it's okay for them to show you the way they do things, once or twice, but they will start to become frustrated with you if they have to continue to show you certain things. And you'll be frustrated yourself because you'll feel like, wow, I am not catching on as quickly as I need to. Number 3, and I think this one is very important, you need to be confident. You need to be confident in what you know. You don't have to know everything, but with the things that you do know, you need to be confident in what it is that you do know. When you go in and you're very, I don't know what I'm doing, I'm not sure, that makes them scared because when you first come in, they want to know that they have an experienced nurse, that this nurse knows what they're doing. I mean, don't get me wrong. If there's something you don't know how to do or you're not familiar with, don't be afraid to ask. But like I said, the things that you are competent in, be competent in them. Be confident in them. Be confident. Number 4, adaptable. Be adaptable. So when you go to one hospital, they're going to do it like this. When you go to the other hospital, they're going to do it like this. And you're going to be like, oh my gosh, do not complain. Do not say, oh my goodness, you guys do it like this here. The other hospital did it like this. Well, that's great. That was the other hospital. That is not this facility. So be adaptable. Just when in Rome, do as the Romans do. That's always my thing. At this hospital, they did it like that. That worked for them. This one, they do it like this. And just adapt to it. That is their way of doing things. You can always suggest, something, but, be adaptable. Number 5 would be to be helpful. That is so important, especially, when you're working in these, on every nursing floor, but especially in the ICUs and in the emergency room. Teamwork is high in those two settings. And so many times, help your peers out. That's also a great way to show them that you are competent and confident in your skills because most people that are not competent or confident, they don't even offer help. So go, help them out, show them that you know what you're doing and that you can participate as a team. Number 6, be proactive. I love proactive people. And what do I mean by proactive? Well, if people need help, I always say the people who need help are always the ones that are not asking for it or they are busy in a room so they don't have the time to come out and ask for help. So be proactive. Look on your charting screen, look and see what orders might be pending for a nurse. Go and ask the nurse, hey, is it okay if I do this? Or if you hear that nurse is overwhelmed, just go and do something for her or for him. Make sure it's within your scope of practice. But go and do it. If you're in the emergency room and this patient comes in dizzy, has all these symptoms of orthostatic hypotension, just do the orthostatic blood pressures. You don't need to, wait, for it to be told to do them. If you kind of already feel that, they're going to need this is within my scope of practice, just go ahead and do them. And it shows, to the doctors, to the nurses, to the people that, wow, this girl, this guy, this nurse, they really know what they're doing. Because a lot of travelers, they want to travel and they go places, but then they get to certain places and the staff may not necessarily like them because they may be like, well, we don't know if this nurse knows what they're doing. So you don't want to be that nurse. You don't want to be the nurse that the rest of the nurses and staff feel like, does this nurse know what they're doing? You want to be proactive. You want to be helpful. You want to be confident. You want to show them that you know what you're doing. Number 7, be kind. I know that sounds very elementary, but I'm serious. Like I said before, a lot of the nurses or staff, they may not like that you're there. A lot of the people, they don't really, you know, they're like, oh, here's the TravelER people again. They're annoying because we have to, you know, be helping them all the time because they don't know our ways. You know, they don't really know what they're doing. So sometimes I would say 95% of the staff will be happy that you're there, which is great. The other 5% may not be that happy. And so be kind to them. I think you will always win people over with kindness and with love.
Aww.
So I really do feel that way though. So just be kind to them. You know, sometimes, you know, staff that has been there for 30 years, they will be all in your face trying to tell you stuff. Just listen. Be kind, smile. Don't be fake. There's a difference between being kind and being fake. Don't be a doormat, but be kind to people. Be nice, show them love. Thank you. Number 8, nobody likes a know-it-all. So don't come off as one. There's a fine line between being confident and being a know-it-all. So be confident in what you do, yes, but don't walk around with your nose all up like,
girl,
you guys do this here? Oh my goodness. You guys are so behind in the times.
Like dinosaur hospital.
Who do you think you are? Adapt to them. Don't, you know, be confident, but don't come off as a massive know-it-all. I know for me, I always have to be mindful of that. To not come across as that, because working at so many hospitals, I get to a hospital and I'm like,
this place
looking like, wow. So luckily for me, a lot of times other nurses will come up to me and ask me, so what do you do at other hospitals, or what is this? You know, they ask me, and when you ask me, then I can tell you. But if they are not asking me and stuff, I'm not going to just start rambling off all these amazing different ways that other hospitals do it and how they could improve in this area. But if they ask you, feel free, but do not walk around as a know-it-all, because that is a great way to not be accepted or and have a hard time during your assignment and having a hard time with people helping you. So be confident, but don't be a know-it-all. Thank you. Number 9, be positive. I know that sounds so basic, but you don't know how hard that is for a lot of people. If you're watching this and you work in healthcare, you know how much hospital people complain. We're always complaining. There's so much complaining, you know. The nurses are complaining because they're being overworked. The techs are complaining because they're being overworked. It's busy, I'm hungry, I need lunch. I mean, there is so much complaining. Do not add to it. Be positive. Go to work and say, guys, we're gonna conquer this, teamwork. And everybody's gonna be looking at you like you're crazy, but it doesn't matter. Be positive, you know, bring in good energy. When people see you, they're like, oh, Monique's on the schedule, so-and-so's on the schedule. Who's that? Oh, that's the TravelER. Okay. People start spreading word of mouth that you're there, that you're pleasant. You start working with people, and people say, oh, you're Monique, I've heard about you. And you're like, oh, great, you know, I'm glad, I hope it was good things. And people look forward to working with you. You look forward to going to work. You know, really creating that positive vibe in your mind and around you, it works wonders. Nobody wants to work with complainers. There are many characteristics that make up a great and successful travel nurse. However, we will end with number 10, which I will say, people do not care how much you know until they know how much you care. So with that said, it is all in your personality. That is number 10. You know, be kind, be positive, you know, all these personality things. You could suck as a nurse. Let's hope you don't suck as a nurse, because, you know, patient safety is our number 1 goal. But, you know, you don't have to be the smartest nurse. Get over that fear of, oh my gosh, my skills are not all up to par. Before I started travel nursing, I was afraid of intubated patients. You know, I did not want to have patients on breathing machines, all these things. I got very used to it. You know, and I am completely comfortable now. It doesn't matter. Get over the fear of that. Go in with a great attitude, with a great, you know, personality. Just go in and you will learn. Be teachable. It will be fantastic for you. It will be. I hope you guys enjoyed my video about the characteristics of a successful travel nurse. I'm not here to put anyone down. If you don't have all of these qualities, that's okay. You can still travel and you can still do an amazing job. These are just some things that I found to be very helpful when traveling. If you enjoyed this video, hit that like button and subscribe to my channel so that you won't miss the next one, where we talk about how to score the assignment that you want. See you later, guys.